Hello, I'm Dr. Bello. I'm the director of our behavioral health services here at Cure for the Kids Foundation, and I also direct our Storybook Homes long-term follow-up clinic, which is our childhood cancer survivor clinic. I am a board-certified neuropsychologist, which basically means that I'm a licensed psychologist, but I also have extra training and fellowship training in brain-behavior relationships. I'm one of the few board-certified neuropsychologists in our state, and I'm here at Cure for the Kids.
Hi, my name is Claudia Clendenin, and I am the licensed social worker at Cure for the Kids.
I'm Sue Baltimore, and I'm a child life specialist.
As director of the behavioral health department, I manage a team that focuses on the psychosocial needs of our patients and families. And basically what that means is that we look at how people are coping emotionally with diagnosis and their treatment. We offer any support and services they may need and determine next steps for what can help them after treatment.
My day-to-day work life consists of helping families find the resources that they need to just kind of make this whole experience better and less challenging. I can assist with finances, emotional support, anything to do with school, basically any non-medical needs I am more than willing to assist with.
My day-to-day work consists of a lot of variety. No 2 days are alike. Each morning I grab a patient census so I can look and see who's coming in for the day and kind of anticipate where my needs might be prioritized. I help a lot with kids who are getting their port accessed or IVs started or having procedures. Certainly new patients are a huge priority because I help them understand their diagnosis and their treatment and the different things that go on here and identify coping techniques for them to manage the things that are difficult for them.
So basically, you have a number of things going on for a child. You have whatever is the disease that may be causing problems on their brain and their functioning and their thinking skills. You also have any treatments, so as I mentioned, some of the medications that are given to help the child and cure the illness that could cause problems in their thinking skills. And then you have development, where the child may already have had some problems in their thinking skills, and that's added on top of that. So all these things together can make some difficulties for a child. And so my role is to find out what is going on and what recommendations we need to make and help them. There's different resources that we can use in the classroom or outside of school, and different therapies and rehabilitation treatments that can help the children.
I think my biggest obstacle or challenge at work would be two things. One is finding all of the community resources for our families. Sometimes that is definitely a challenge, especially here in the city, where maybe we don't always have all of the resources that are needed. And I think my second challenge would be motivating families to ask me for help. I know that it could be a really hard time, especially when your kiddo is diagnosed with something like cancer. And so I think sometimes it's challenging for families to approach me, but I just want everyone to feel comfortable and just to know that someone is here to help.
My biggest obstacle at work is probably that I can't be in two places at once. And inevitably, I wear a radio in my ear, and I'll get a call for helping with a port access in one room, and then a couple seconds later I'll get called for an IV access in another room, and so it's sometimes I'm needing the nurses to wait for a few minutes so I can do one and then get to the second one in time.
Back when I joined about 6 years ago, there was no my department. It was me by myself. I was the only mental health person in Cure for the Kids. And so I got pulled to do a number of different things that are usually not typical jobs of a neuropsychologist. But here at Cure for the Kids, it's, hey, whatever the patient needs at that moment. So I had more flexibility in terms of my skills and developing those skills. Soon after, we had Sue Baltimore, our child life specialist, join, and she was initially working at Candlelighters, and we decided it was a better fit for her to join with us and see all of the patients. And so then we sort of became this small team of two. More recently, the team has grown a lot, and we're even talking about more expansion. And so it's just been this huge growth.
If you see me in clinic, please feel free to pull me aside. I'm more than willing to help with anything that I can, and I definitely appreciate any feedback you might have for me.
Well, I'm Miss Sue, and if there's anything that I can help you with, if you have questions about normal growth and development, parenting issues, behavioral issues, if you just want to have someone there to distract a patient during something that's going on. I've got all sorts of tricks up my sleeve, and I'd be more than happy to come and help.